Before watching this video, click on the subscribe button.
Assalamualaikum. Today I have a video on Seroft 50s that composed on Sertraline HCL, and the composition is that the Seroft is available in the 50 mg and as well as the 100 mg. So this medicine that I'm going to talk about, the Sertraline and HCL USB, is 50 mg. Okay, so the clinical pharmacology and the mechanical mechanism of action. Sertraline potentiates serotonergic activity in the central nervous system through inhibition of neuronal reuptake of serotonin 5-HT. Okay, so the indications about the sertraline is indicated for the treatment of the following: major depressive disorder (MDD), obsessive compulsive disorder (OCD), panic disorder (PD), post-traumatic stress disorder (PTSD), social anxiety disorder, and premenstrual dysphoric disorder (MDD). Okay, so this medicine is very useful in that types of disorder. You may said that the neurological disorder. Okay. If inadequate response to starting dosage, titrate in 25 to 50 mg per day, increments once weekly in MDD, OCD, PD, PTSD, and SAD. When discontinuing is sertraline, reduce dose gradually. Okay, now the hepatic impairment. I'm going to talk about the hepatic impairment. So the mild recommended starting and maximum dosage is half recommended dosage. Okay, now talk about some contraindications. So the Seroft is contraindicated in patients taking or within 14 days of stopping. Okay, MAOIs because of an increased risk of serotonin syndrome. Taking pimoside with known hypersensitivity to sertraline. Okay, the warnings and precaution is the serotonin syndrome, increased risk when co-administered with serotonergic agents SSRI, SNRI, tripens, but also when taken alone. If it occurs, discontinue sertraline and initiate supportive treatment. So this is all about this medication. Okay, increased risk of bleeding. Okay, activation of mania scissors is ankle closure, glaucoma, OTC prolongation. Sertraline should be used with the caution in patients with risk factors for QTC prolongation. Okay, so this is all about the cautions when you are using this medicine. So to take care of these kinds of risk. Okay, now adverse reactions. So what about the adverse reaction? So the most common adverse reaction in pooled placebo-controlled MDD, OCD, PD, PTSD, SAD, and PMDD clinical trials were nausea, diarrhea, loose stool, tremor, dyspepsia, decreased appetite, hyperhidrosis, ejaculation failure, and decreased libido. Okay, now talk about the drug interaction. So SSRI or related antidepressant should not be started until 2 weeks after stopping an MAOI. Conversely, an MAOI should not be started until at least a week after a SSRI or related antidepressant has been stopped. Protein bound drugs and CYP2D6 substrates. Use in the special population, so always take care about when you are using this drug regarding the pregnancy, pediatric use, geriatric use, hepatic impairment, renal impairment. Okay, so now what should you do in case of the overdosage? The most common signs and symptoms associated with non-fetal sertraline overdosage were somnolence, vomiting, tachycardia, nausea, dizziness, agitation, and tremor. No cases of fatal overdoses with only sertraline have been reported. No specific antidotes for sertraline are known. Now talk about the instructions and the presentation that is given in that leaflet. So Pharmatech, okay, is the company, and this is all about information. If you like this video, so don't forget to click